My relative has been diagnosed with breast cancer. Is it possible to avoid chemotherapy?
So it's a very interesting question. Can we avoid chemotherapy for breast cancer patients? Now, I know many patients are worried about chemotherapy because they look at patients who have side effects of chemotherapy. And even the medical community does worry about it. And over the years, we have tried to find some answers. Traditionally, we used to say any patient with a tumor size of more than 5 millimeters would get benefit out of getting chemotherapy. Now, the things have changed slightly in the past few years with the advent of newer risk stratification tests. What are these? These tests are basically a test done or performed on the tumor tissues, even on the tumor tissue which is removed by true cut biopsy or the tumor tissue which is removed after surgery, that is sent for further testing, and that these test results will tell us whether this patient has a requirement for going for chemotherapy or not. Now, these are performed for hormone positive breast cancers, which means ER and PR should be positive and the HER2 should be negative. Those of you who have gone through breast cancer or have gone through some aspects of breast cancer would know these terminologies, and if these factors are in favor, that is ERPR is positive and HER2 is negative, then these patients are eligible to go for a further risk stratification test. There are various tests available in the market. Some of the internationally available ones include Oncotype DX, there is something called MammaPrint, there is something called EndoPredict, and the Indian variety of it, what is called as Scan Assist Breast, is also available. And these products, all these types of tests tell us whether a given patient is at a higher risk or a lower risk for recurrence. So any patient who is in the low risk category can avoid taking chemotherapy and thus avoid all the side effects of chemotherapy. Whereas the high risk patients will have to take chemotherapy because we know that there is a benefit. So this is how it is possible to avoid. It is not possible to avoid chemotherapy in up to 50% of the patients because of various reasons. So this is an added cost. If you are willing to take it, it is possible in some patients to avoid further chemotherapy or start chemotherapy altogether. Thank you.